to other meetings. Good afternoon, everyone. This session is going to be dedicated to the issue of human rights in the pandemic. In response to COVID-19 and in particular SDGs 4 and 5. The third goal is as follows. Enable everyone to live in good health and ensure the well-being of everyone at all ages. We know that the world currently is caught up in a pandemic, that's COVID-19, leading to a lot of suffering, upheavals in economies, and so on. Before the pandemic, we all already had a problem of having healthcare for millions of people. Today, it's a great risk for all of humanity. Now, objective number 4, the fourth goal is ensuring equal levels, equal educational opportunities for all. We know that education is a tool that will help many people get out of poverty. In 2020, this pandemic broke out throughout the world, and this led to temporary closure of schools. And according to UN figures, a lot has been shut down. We know that UNESCO is trying to correct the anomaly in the educational sector, in this sector. So we have several panelists amongst us. The first panelist is Mr. Gbenga Sesan, who is the director of Paradise Initiative, a Pan-African company that works throughout Africa through its offices in Cameroon, Nigeria, and so on. And also the leader of social digital CV, and he works in more than 35 countries. He's an engineer by training. Our second panelist is Mr. Scott Campbell. He's principal expert on human rights and technology in the High Commission for Human Rights, where he's an expert in technology and human rights. Before then, he was the head of African section for human rights in the United Nations. He speaks several African languages, including Lingala and Swahili. Third panelist is a lady, Nanlop A. She's a professional in international development with local and international perspectives. She's a healthcare professional with specializations in advocacy. She is the principal advisor in West African Health Organization, where her experience comes to bear in the area of development. So without much further ado, I'm going to give the floor to the panelists. I'll ask the first panelist, Mr. Gbenga Sesan, to do his presentation. The presentations will focus on two major subjects: the Sustainable Development Goals, number 3 and number 4. Mr. Gbenga, you have the floor.
Thank you very much for having me. And I am glad that the conversation for the West Africa Internet Governance Forum continues, even though the conditions are not the best. I mean, many of us are at home with kids, trying to get them through school. But I think this also speaks to the major challenge of the time. You know, we're talking about human rights and we're talking about the current pandemic. And I want to say, you know, 3 very quick things. Number 1 is the need to number one is the fact that we are currently witnessing something that requires a lot of trust. And when I say that require a lot of trust, various institutions definitely need to work together. So we're facing a global health pandemic, and at this time, governments, civil society, academia, we should all be working together to fight this common enemy. But unfortunately, one other thing that we have seen is that at this particular time, we also have a few situations where, data, of course, is being collected, and it's not, being used in such a way that it respects rights, privacy rights. We do know nobody wants to deny the opportunity for health service providers to be able to solve problems, especially the problems of the pandemic. But unfortunately, at the same time, it should not be an opportunity for us to then do. So I'll give very simple examples. Example is around data collection. So when we do collect data collection has to have a purpose. It has to be used for the purpose that is being taken for. And thirdly, if for any reason that data is abused, the person whose data is misused should have an opportunity to seek redress. What we have seen, in our Worker Paradigm Initiative, what we're seeing across many African countries is a scenario where, unfortunately, we have many countries that are collecting data on opposition members, are using the opportunity of a pandemic to also create a second problem, which is, of course, a human rights problem. We've had scenarios where people have been picked up because they've asked questions, and I should use a very present example from Zimbabwe. A journalist in Zimbabwe is asking questions about the pandemic, about how money is being spent, and just 2 days ago to today, we've had a scenario where journalist has been arrested. Not only has he been arrested, he's being charged under many guises. And unfortunately, which brings me to my second point, on human rights. Unfortunately, we're a continent that has many laws that are not exactly very friendly. And when I say not exactly very friendly, I mean that many of our laws present an unfortunate situation where the focus to solve problems, but the focus is to seek control and gain control and the situation, unfortunately, is where we have laws that allow people to, to retain control and to question people who ask questions. And I think this is unfortunate. Over the last 5 years, 4 years in particular, the last 4 years, Paradigm Initiative has been producing what is called the Digital Rights in Africa report. And what we have seen in this report is the reason we are not surprised when we see some of the violations that are happening during this pandemic. And by the way, these human rights abuses have been documented by different organizations, including ours. Glad to see people speaking up and saying that, yes, we're fighting a common enemy, which is the virus. This is not a time for us to lose trust in each other between government and companies and civil society, but it is important that someone keeps records. And the reason for this is because seeing things in name of national security, and they become the new normal, where people's private conversations are being monitored, either because they are popular or because they are people of interest. So my first point is the fact that we have a global health pandemic. It should not also be a time when we create a second wave of data pandemic. And secondly, we are a continent that has many laws, many of which are not rights respected. It is unfortunate that, even when we're speaking about a lot of data collection at this period, we do not have up to 30 countries on the continent that have data privacy laws, which means that if I, as an individual or anyone, has their data abused, they do not have the opportunity to seek redress. And I think we need to work hard on this. And my thought, by the way, and final point is for us to focus on the opportunities. Right now, a few minutes ago, you would have heard my daughter and my son in the background. And the reason for that is because they're all at home, learning from home. When kids are learning from home, that is not a time when we should be hearing about internet shutdowns in Chad or in Ethiopia, which we have heard about, right? During the same period, how do the kids learn if the platform where they should be learning has been shut down, or the platform where they should be learning is not available? I think Africa has a unique opportunity to use the lessons we've learned during this COVID period, now that we know that internet is a fundamental need. We have said before that internet is a fundamental right, and if there were any time in history that this will be proved to us as important, it is now. If our kids, Africa already has a few disadvantages in terms of economic opportunities, in terms of technology competition, but if we don't want to repeat a cycle of disadvantage, then we need to make sure that our kids, our young people, and everyone has the opportunity during this period to use the internet to learn. It is the same platform that we also are using to work. My office has been working remotely since March 24, and that's going to be happening for a while longer. And that means that if people do not have internet access, they can't get work done. If they don't get work done, there will be no economic benefits at the end of the month. If there's no economic benefit, then we're dragging ourselves back as a continent. So I think, and I don't want to say this in too many words, but I want to say that, number one, we're creating, unfortunately, we're creating a second problem during this health problem. And that is a problem of abuse of data and abuse of human rights. And we need to stop that. The second is that we have an opportunity to address many of our laws that have, challenges. We've recently reviewed the EPOCA. That's the law in Tanzania that, and some of these laws are very, very interesting, to say the least. If as a country, Tanzania says that we're going to ask people to pay licenses of around $27 before they can start blogging, because we want to earn revenue. If Uganda is saying we're going to introduce taxes before you can get online, now we heard that Zimbabwe is considering charging, TV licenses for anyone that can, radio licenses for anyone that uses a mobile phone, because you can use that to access the radio. When we put those bottlenecks in the way of our people, what we're doing is that we're creating an unfortunate category. We already have those who are connected and those who are not connected, the unconnected. We're creating a third and unfortunate category of the disconnected. Disconnected because of economic barriers, disconnected because of laws and policies that don't favor us, disconnected because during a pandemic, when we should be focusing on solving the problem, we're creating a second wave of problems. I'd like to stop here. If there are questions, I'm happy to take them. And I look forward to what the other panelists will share on this topic of human rights and this pandemic that requires for all of us to work together instead of creating second and third and fourth wave of problems. Thank you.
Oui, merci beaucoup, Monsieur Gbenga. Donc, vous avez notamment...
Thank you, Mr. Gbenga.
Beaucoup de la confiance qui devrait être créée afin d'utiliser à bon escient toutes les informations qui sont collectées durant...
You have said that we need to ensure appropriate information data which would have been created during this pandemic will serve the people rather than tracking opposition and so on. You have said that we should draw a lesson from this pandemic to understand that the internet is a development tool. which can help children learn in school. So thank you so much for that presentation. So let me give the floor to Mr. Scott also for his presentation. Thank you. Thank you, Doctor. Can you hear me? Yes, I can hear you, and I hope everyone can hear you. Yes, I can hear you too. Good afternoon, everyone.
Thank you, and thank you very much for including me in this very important forum. As Dr. Traoré mentioned, my name is Scott Campbell. I work for the United Nations Human Rights Office, currently based in New York, and I lead our work on digital technology and human rights. It's very much a pleasure for me to be here this morning with my colleague, some friend Gbenga. As I've spent much of my career living and working in Africa. So thank you sincerely for having me. I work very closely with the United Nations Office of the Secretary General, with the Office of the Special Advisor to the Secretary General on Digital Cooperation and across the UN system. And so I thought I would try to bring in that perspective and that of the UN Human Rights Office into the discussion. We work very closely with civil society organizations around the globe, also directly with tech companies and with governments, and in particular on follow-up to the Secretary General's high-level panel report on digital cooperation and the recent roadmap that the Secretary General has launched to implement the recommendations of this report. But I'll touch on those points later. I just wanted to say a few words about the question of a human right to the internet before touching on some of the human rights relations with SDG 3 and digital technologies. I think, firstly, on the internet as a human right, there is, in fact, much philosophical debate over whether there is or there should be a right to the internet itself. I think rather than diving into this debate or trying to resolve it, I think what's important for us to consider is, while there's no specific basis in international human rights law for a human right to the internet per se, what's very clear is the fulfillment of so many human rights. It depends on access to the internet and how important it is for all of us, for states, for the United Nations, for civil society to be promoting access to the internet. The internet is, of course, such an important enabler of many other human rights. In particular, access to the internet allows us to seek information, to receive information, to share information of all kinds and almost instantaneously, and also relatively inexpensively and across many parts of the globe, of about half the planet where there is connectivity. So by vastly expanding access to the internet, of course, we increase the right to freedom of expression and access to information. And the internet can serve effectively as an enabler of many social and economic rights through online business, through political participation, and civil and political rights as well. This leads me to the next point, and on a crucial issue that I wanted to touch on, of internet shutdowns. Some states have taken measures to cut off the internet altogether, and I should note that many of the international human rights mechanisms and our office, our High Commissioner for Human Rights, consider that cutting off users from the internet, blanket shutdowns, regardless of the justification provided, are considered to be disproportionate. And that's a violation of the relevant international law, of note the International Covenant on Civil and Political Rights. And we believe firmly that any restriction needs to have a clear basis in law, be necessary, and the least intrusive means while protecting the rights of others. And this is incredibly important, I think, at this time of the COVID-19 crisis. It's very crucial that governments refrain from blocking access to the internet. I think also important to mention are efforts by the UN Secretary General in the United Nations that have been very engaged over the last few years in promoting universal access to the internet by 2030, as noted in the SDGs. And I'll come back to this later in the discussion, and what the UN has been doing concretely and is proposing concretely to increase access to the internet. But before I close, just a few quick points relating to the right to health, as internet and digital technologies play such a crucial role in advancing progress towards fulfilling the right to health, but also serve as a double-edged sword, and Gbenga referred to a few of them, as digital tools and social media can also pose certain human rights risks. So while access to clear and accurate information on COVID-19, for example, is so important today, and if you have a smartphone, if you have access to the internet, you can use digital technologies to track and to trace COVID-19. There are a number of important challenges. Digital technologies, of course, are being used with social media to spread disinformation and misinformation on health in general, and today in particular around COVID-19. We've also seen very high levels of hate speech and stigmatization amplified through social media, and increasing discrimination against minorities, ethnic minorities, various nationalities. And this is something that's not new, but has been exacerbated in the COVID-19 era. Linked with that, there's also a risk that states use this proliferation of hate speech to create legislation, laws, decrees that may include criminalization for very vaguely defined offenses of hate speech, and whereby we have seen examples of governments defining hate speech very broadly, and thus using laws to suppress any form of speech that may be critical or may present an opposing view or one that's not in favor with authorities. And thus we've seen severe limits on freedom of expression, freedom of assembly and association, and at times a general chilling effect on participation, and an increase in the trend of shrinking online space. I think Gbenga touched on the questions of data and the rights to privacy. These, of course, tie in very, very closely with some of the public health initiatives to use technology to try to improve the response, the public health response, improve tracking and tracing capacity through using apps and digital tools. But of course, that comes with great risks of the right to privacy. But I'll leave it at that for now, and look forward to questions. Thank you.
Merci beaucoup, Monsieur Scott, pour votre intervention. Je profite de l'occasion pour dire en passant.
Thank you. Let me seize this opportunity to say that French interpretation is not coming through, so perhaps technical people can help us in this regard. This COVID-19 has given us opportunity to improve internet access in some countries. You also took note of the stigmatization brought on by COVID-19, and this can be avoided by correct information that's using ICT to manage that development goal, that is the use of internet connectivity to better address the needs of people in that area. Thank you so much. I believe that there will be questions whereby we will come back to you. So at this point, let me call on Mrs. Nagmut Abouele for her presentation. Thank you.
Good morning, good afternoon, whichever part of the world you are. I'm Nanlop Ogbureke. I'm the Senior Special Advisor to the DG WAHO. I've been with WAHO for the last this is my 8th month. I'll be talking still on the subject, but I'll come from the perspective of what we've done. I'll start by talking about the impact on SDG and looking at the benefits or the importance of IT when we come to delivering and ensuring on health access for all. And then I'll talk about education. But before I begin, I think there's some certain words that come to mind. Most of my career has been in international development, like I've been introduced. And a lot of that has been using human rights-based approaches to deliver interventions, and also even in the framing of whatever policies, looking at those policies through the lens of human rights and also even in terms of implementation, whether at the health, whichever sector, but of course mostly on health sector. So most of the examples and what I'll be talking about will be mostly on SDG 3 and also linked to SDG 4. The words that come to mind include, when we talk about human rights, you talk about inclusion, we talk about equity, equality, issues of gender, discrimination, which Scott has also touched on, and the same thing the other speaker, Gbenga, has also mentioned. There's also issues of entitlement, legislation, policy, but more importantly, it's about voice, it's about power, it's about the agency of people. And I think that those are very critical words that we should bear in mind when we talk about human rights. All the SDGs has already been, are all underpinned by human rights. They are all looked at through the lens of, through a human rights lens, and especially driving the leave no one behind agenda. And I would say that at the end of the day, it's about digging deeply into our humanity and essentially talking about, our inherent rights as all human beings, whether it is with information technology or even more importantly, our rights to health and education. I think secondly, the other thing I'll highlight is that when we talk about human rights, what came to mind will be the human development indices, and there are 3 major dimensions to it. So one is, of course, related to health, the other is to education, and of course, the other is also has to do with standard of living. But for the purposes of this discussion, we're looking at SDG 3 and SDG 4. But I think health has been defined and health has been established as a human rights issue. And of course, with looking at health through an integrated health approach it's actually on the front burner now, but it's something we've worked on for a long time. And I'm sure even Scott touched on that as well. But it's important to just reflect a little more and realize that when we talk about human rights, it's linked, of course, to reducing poverty in our own region. And that's where the question of context comes in. So we talked about policies, we've talked about what some of those policies could either be enabling or disenabling, depending on how they are framed and how they are also applied, depending across the African continent and in our different countries. And so when we talk about health as a fundamental human right, it's inherently already enshrined in Article 25, of course, of the Universal Declaration on Human Rights. And these are issues and these are questions that are raised. And with the pandemic, it has, of course, put in barriers, not only with the pandemic, but also recognizing what the impact of the pandemic has led to. Some of the measures, the non-pharmaceutical measures that have been put in place, the lockdown, what that meant, and the ripple effect it has had to have more children, to have children at home, to be educated at home for those who are privileged. But then it also has exposed the already weak systems that we have and exacerbated the already existing challenges that we have. And that touches more on talking about having secure access to data to make sure that access to health services are affordable, that even for contact tracing, for example, when we talk about COVID, those are some of the ways in which internet has been very useful, especially in responding to for the COVID-19 response. But then there are two sides of a coin. On the one hand, we're talking about accessibility, which has been there even before the pandemic as one area that we've been pushing, and looking at all the vulnerable and marginalized groups who do not have access, and how do we widen, expand the reach and ensure that even those who usually wouldn't even have access to some of these internet facilities have access. Now, for health access, there are other platforms and digital solutions that exist that have been used so far to be able to promote and ensure that people are able to access services, quality health services. So far, within the region, there have been questions about how we ensure that people get tested. I'll use that as an example. So, of course, the internet, the mobile applications have been used. We've talked about risk communication and behavior change communication. So IT is very relevant there. And so integrating this and using new technologies that are innovative are very, very useful in that regard. And therefore, it throws up the question of how do we deal with those gaps that I had mentioned earlier, where the larger population do not have access to health services. Talk more of even dealing with having access at a cost usually to IT services. And I think all of us here, most of us have in one way or the other, will be determined or categorized as those who are privileged, who have access to these resources. But we should not forget that almost 60 or 70%, depending on which country, live below the poverty line and therefore may have very limited access. And therefore it's an important conversation to have. I think just to put it in perspective a bit, I think it's important to also understand that over how many million, about 11 million, I think from the last data that we're aware of Africans are pushed into poverty daily. And all of this is because they keep seeking healthcare abroad. You have also those who, even if those who can even afford it, who go to Europe. But the pandemic throws in another thing into the wheel. Not many people are able to fly out. We have to be able to rely on our own already weak systems within the region. But how this provides, when we talk about IT solutions, that also throws up the opportunity to strengthen our systems for data collection, analysis, disease surveillance, even for health professionals to be able to do their work, to be able to track those who are affected by COVID, and even also to address the issues of essential health services and strengthen access. So yes, I think overall, when we talk about health, the SDG 3, and we talk about the role and the place of IT within that, there's already conversations on e-health solutions, digitalization, but we know that we've not reached there, and it's good to know that this conversation has started. So the call lines are available, hotlines are being used for people to call for testing when it comes to COVID, reporting of results, disease surveillance or contact tracing, and a lot has been happening with data collection and aggregating this data, information. But then it throws up the question of security and the use of data. Social media has been touched on with erroneous information and how harmful that can be. But then on the flip side, how do we make sure, the rhetorical question will be that we're actually using this to be able to strengthen and ensure that we're able to put out the correct information using different platforms, IT platforms. So moving on, and I'll go straight on to education and talk about quickly before then, actually, I think for WAHO, there's been a lot of work that we have done to build or strengthen the technical capacity within the 15 member states. And this conversation started when we convened, when WAHO convened a digital health, brought in all digital health platforms to be able to adapt this and have a discussion on the challenges post-Ebola, and taking those lessons from there to see what we could do to strengthen the public health use of information, health information management systems. And so we have a policy, and that is what is driving the work that we do within the region or the sub-region. But for education, I won't say so much. I think it's been discussed extensively because Gbenga has touched on it, and he has a practical living experience because we could hear his children in the background. But I just want to touch on a few things. One is just recognizing that even while our children go online, cybersecurity, which was the discussion that we had before our session, is very important to be sure that children who are unsupervised are able to just do their work without any distractions, and not, going into sites that are a challenge. And that in itself are also some of the, when we talk about IT protection and thinking about protection of not only those, but then this webinar in itself is our new normal. We've had many webinars, but it is also an indication of the importance of IT to be able to communicate and provide correct information and share information and learn from each other. But then virtual and online education for adults and for mostly adults, universities and academia has also been something that has been done, but it's also much more to the fore. But most affected are children in primary and secondary school. So that touches on questions on censorship when we talk about the internet, when we consider children who are online, but it also brings up the issues of the larger population of children who are out of school because of this. And because they don't have access to IT. And then that really increases the importance for why it should be integrated within the systems, whether it is for access to quality education, whether it's also, and it needs to be affordable for them to be able to access this, just like any other sectoral issue. But to be able to address this, I'll need to touch on collaboration, the importance of partnerships, dealing with the civil society, and recognizing how partnerships is very important and critical between the government, because it's the connecting thread that links all of this together. And so when we talk about human rights, it is a right of every individual to have access to internet, because it has the impact and the implications to strengthening even our responses, whether for pandemics, but also broadly for the health sector and other social determinants. Is also part of some of the contributors to strengthening our economies and reducing poverty overall. So thank you very much, and I'll end there. Thanks.
Thank you so much for your presentation. You talked about health systems, inclusion, equity before the law, and so on. You have also considered that, according to UN definition, access to health is a common good for everyone. Everyone should access it. You have also said that health should be seen as an integrated system. It's not just a matter of having good health, but what is the person's environment? What health access does that person have? Well, how can ICT and internet connectivity help such a person to access health systems? You also talked about digitalization, which can help better analyze health systems in member states and countries. You also talked about the security of such systems, so that information that are being put in IT systems be well protected. You talked about education, you talked about cybersecurity in the education sector. Given that with the pandemic, so many children are learning from their homes how to ensure that educational sites are not hacked, and how to protect these children during their learning process. You also talked about cooperation amongst states. The interpreter has lost sound. The interpreter has lost sound from the speaker. And also urging member states not to waste time in striving to achieve the SDGs. Thank you so much for your intervention. There are some questions that were asked. We have about 15 minutes. A question was asked with regards to Mali. I can respond to that. A question was asked whether Mali is part of the IGF process. Yes, the Mali IGF has been set up with all stakeholders involved after widely held consultations. So the executive director of the IGF has ensured that internet governance is widely discussed. We had our first meeting, which was held with more than 400 participants, and we also had remote attendance. So Mali is well in part of the IGF process. The second question was that internet is a human right. But we have noticed that our part of the world is behind time. And the question is, what mechanism should be put in place to reverse that trend? So I'll give the floor to all the panelists to express their views on that question. Thank you. Let me start with the first, and then we'll go on. The second and the third will take turns to speak. Thank you.
All right. Thank you, Mr. Moderator. So in terms of redress mechanisms that we can use to challenge these violations, I think the first thing is to keep records. And that is important because regardless of what mechanism we use, we will need accurate details, because at the end of the day, you do not want to do advocacy or seek redress based on emotions and without facts. And I think that's important. Now, having done that, the second is to make sure that we create a lot more awareness. Unfortunately, as we've seen from many of the studies we've done over the last 4 or 5 years, Apartheid Initiative, in many countries across the continent, people do not regard human rights as a major priority. Many times you'll hear people say things like, let's treat hunger first, and then we can go to this Western idea of rights and things like that, which is absolutely not the case, because we know for a fact that economic opportunities are tied to rights. We know that livelihoods and even life itself is very much related to the opportunity to enforce your human rights. So I think it's important for us to create a lot more awareness. We can't leave this to the orientation agencies of governments. We can't leave this to development partners. We have to do this, the private sector, academia, media particularly, and also civil society. We need to create more awareness and let people know what their rights are. Let people know that when you are asked to do certain things, you have a chance to ask questions and you can seek information and get answers. The third, and I think something that I want to encourage a lot more of, is also to use the route of litigation. We need to test the laws across our various countries. Many times when certain actions are taken, because we don't ask questions, because we don't go to court, we think, oh my God, the judiciary is already tainted, they won't even give us justice. But until you test, you can't be sure. The ECOWAS court just gave judgment against the government of Nigeria in terms of the cybercrime law that was being abused. The ECOWAS court just gave judgment in terms of the Togolese internet shutdown. And we've seen that happen, from other courts, or other regional, especially courts across the region. So we need to do this for 3 key reasons. Number one, when we do that, then the people who abuse rights will know that we're serious. Then secondly, we're creating judicial precedent so that subsequent cases can have things to refer to. And third, we also need to celebrate the small victories. When we have a small win, when we have a big win, we need to celebrate this so that the reason why people continue to abuse rights is because of impunity many times. But when they know that we will seek redress and we may get judgment, or at least we may take them to the court of public opinion where they will be named and shamed, then some of them, of course not all, there's some perpetual violators who will not change, but at least some, will consider not doing it again. So I think it's important for us to keep records. It's important for us to test the laws, and it's important for us to do a lot of awareness. Thank you.
Merci beaucoup. Donc, je passerai la parole à...
Thank you. Let me give the floor to Mr. Scott. Thank you for that answer.
Merci, docteur. Je compléterai Gbenga. Je pense qu'il a déjà couvert beaucoup du terrain.
Thank you, Gbenga.
My answer on redress for human rights violations, also with another question that I saw in the chat on what to do about the recent shutdown, internet shutdown in Mali. I think just building on what Gbenga said, how one seeks redress for a human rights violation does depend on the nature of the violation, and one may choose different routes of redress. But in short, I think it's firstly important to push through national institutions. Gbenga mentioned the courts, legal routes. This is very important, at least to try to push these mechanisms to provide redress, to claim your rights. There are also national human rights institutions in most of the countries in West Africa. Also here, important to note, I think the crucial work of civil society organizations, human rights groups, and legal aid groups in assisting victims to claim their rights and to claim redress. What I think we should be clear in noting that these national level mechanisms don't always work, and there are regional and international mechanisms. There's the United Nations Human Rights Council, which has mechanisms and its special procedures where one can share information, raise awareness. There's a specific complaints procedure also at the level of the Human Rights Council for certain types of violations. And then importantly, at the regional level, the African Commission on Human and People's Rights and the African Court, as well as the ECOWAS Court, which indeed has just really put down some important positions that, as Gbenga noted, should be celebrated. Attention should be drawn to them. The shutdown in Togo, I think, was a very important decision. It ordered a monetary compensation to the plaintiffs, 2 million CFA, and instructed the government to guarantee safeguards to respect the right to freedom of expression of the Togolese people. And I think very important there to note that civil society was very much behind that decision. Togolese civil society, West African civil society, and international civil society. Thank you.
Merci beaucoup, Monsieur Scott. Donc, je passerai la parole à Madame Nanlop. Je vous en prie.
Thank you very much.
Thank
I give
you.
the floor to Madame Pablo. Thank you.
Thank you. I think I would re-echo what Scott said. He pretty much stole my thunder. So yes, there were some things he had mentioned. So it's about knowing your rights, first of all. And that links into what Gbenga said about awareness messaging. So we need to know what those policies are. So education is very critical. So that we're very clear on what it is we want to, what kind of redress we would seek, and who is able to provide that, and which court needs to go, because we need to know that from the get-go. But that, of course, leads to civic education, and there's it's a whole stretch for that discussion, talking about litigation issues. Secondly is understanding those existing procedures and what platforms and networks exist, which has already been mentioned. So looking at across, whether at community level, because it depends on what rights have been violated, because we also need to recognize that whatever it is across the spectrum, whether at community level, there should be accountability mechanisms put in place. And when we talk about complex mechanisms as well. I think the other thing I'll talk about is when we talk, just understanding that CSOs are very critical, and those partnerships and collaborations are also important because, like we know, the judicial systems are not exactly very strong, and sometimes it can actually do more harm in some cases, like we're aware. So it's just having a balance between all of this, but it's all centered on information, clearly understanding what the issues are, and knowing what laws or what policies to draw on which platforms. Some of these can actually be addressed when we come at them from a collective perspective rather than from the individual. So that's just all I'll add to what has been said by Gbenga and Scott. Thank you.
Je remercie tous les panélistes. Donc, il y a eu, je dirais même plus de commentaires, pas vraiment des questions, mais beaucoup plus de commentaires. Donc, notamment, il a été spécifié que l'absence d'éducation numérique, l'absence d'infrastructures aurait dû être mieux constatée durant cette pandémie de Covid-19 pour améliorer cette situation-là. Et avec l'absence notamment d'éducation numérique, il est compliqué.
Now, in the absence of digital literacy, it's complicated, whereby people that are supposed to have that right to have access to the internet so that they would be able to gain from the use of digital services. There's also been the issue of cost. So it's an opportunity so that regulatory authorities should negotiate with providers so that service can be provided to people. There's also another comment talking about collaboration on platforms such as IGF, which should be an opportunity so that people can discuss different problems and find common solutions to their different issues, of course, taking into account country specificities into account. The issue of security has been largely discussed. We know that internet started in the early 90s in our countries. The interpreter has lost the speaker. The interpreter has lost the speaker. The interpreter has lost the speaker. So we have a problem of content for us, African countries. The lady talked about databases of health systems, and in our member states, these are not exactly where they should be. The issue of security, this was also discussed in the previous session. We have discussed the problem of security, which we see in all internet interconnections. So that problem has been put on the table by the different participants who are listening to our discussions. I would say that to draw conclusion on the pandemic, I would say that there are two problems. The first thing is that COVID-19 should be an opportunity to first analyze, understand, and find the resources to correct the different deficiencies, internet deficiencies.
The second thing is to understand that there is an opportunity that comes with using ICT technologies to address the development challenges that our countries are facing. So that is the general summary of my take on the presentations and the discussions, the presentations that were held. I believe we have now exhausted our time. It's 15 minutes past noon, but just to say that those were some of the highlights of the presentations. I wish to thank you sincerely for your presentations, and I thank the IGF for giving us the opportunity to discuss these various challenges which are of substance to our countries and an opportunity to get in line with the development train. Thank you.
Thank you very much, Dr. Traoré and your panelists. Thank you all for taking the time out to share your experience and share your words. It's definitely been a very informative session, and it has raised all the